Thank you, everybody else. If you want to leave, you can. Otherwise, Donna, feel free to ask your question.
Okay, so I've come across someone who their household it's a husband and wife, but it's just the wife that's going to be getting the insurance because he's Medicare. Um, their household income is around 500% poverty level. So they were able to get she would be able to get a subsidy this year,
Mhm.
not next, but not next year.
Why
Um,
not next year?
well, in 2025, isn't it, if it's over 400%, they're not going to get a subsidy?
2026.
Oh, they're still gonna get subsidies in 2025.
Yeah, 2025 is when it runs out in the year, so they have to decide by 2025 for the 26 open enrollment.
Nice, okay.
Yeah, so you're good
Um,
for yeah.
well, she will be pleased. Okay, I'll let her know that one. However, she said their AGI for
Mhm.
2023 was a negative 154,000
Okay.
and probably will be a negative for 2024 because of some write-off they had with some property. I guess it was a loss or whatever. So do we have to put that in? She doesn't want Medicaid. So because I'm thinking, well, if we have to put that in the application somewhere so that it shows that, okay, well, their AGI is going to be negative, then she's going to have to go file for Medicaid. And obviously she didn't want to do that.
Correct.
So do we just leave that write off out of the application and just leave it as income? And then they
I
get a big bunch of money back whenever it shows negative at tax time?
Right, because unless she said probably, I don't know where those write-offs come from, all that stuff. Sometimes they come off after the modified adjusted gross or whatever, so I would leave it off because she's not gonna get it on Medicaid. You can apply, she's
Sure.
not gonna get it because
Right.
Medicaid calculates things differently. So
Well,
Medicaid
does
says
she
how much
get,
is in your savings account, how much do you have? So, file it at tax time and she'll get it all back. Um, that's one of those accounting things. It's like it's not really real money. And 2022 doesn't matter. 2023 doesn't matter. It's just, what are you going to make this year? And next year, what is she going to make? So she'll still be able to get it. Now, if she's still doing this write off in 2026, well, and they haven't fixed the income cliff, you know, then you might have to get more creative. But I would leave it off. And if she can afford to make that payment, whatever it is, say you most likely you'll probably get this back. But that's an accountant and an IRS discussion.
okay, but my biggest point is she's not going to get penalized for saying, oh, yeah, I made this much, and then she gets all this write off, and then they give her all this
Never.
money back.
You get
Okay.
no penalty for putting your income higher than you make ever.
Okay, good deal.
I don't care if you say you make 5 million and then you turn out to make $10. There's no penalty. Um, the same as if you say I make 30 and you make 25 and you get money back. They never penalize you for less money.
Okay, excellent. That's all I had. I appreciate your help.
Yeah, no problem.
Always.
Anyone else? I don't know if Arlene is still on. Let me see, because I was gonna tell you what hers is. So she came up. I think she's off. So
I am. No, I'm here.
oh, there you are. Arlene, can I share what
Yeah,
we're talking about? Some
definitely.
complicated. Can I share what
Definitely.
you called me about? So Arlene just dealt with a situation where there's a husband, wife, and a daughter on the ACA, and he is disabled, and he was approved for his Medicare it backdated. It was February. And then part B was like at a different time. So nobody knew. He was unaware of this. Heck, sometime, I had one, they were backdated 2 years. And they had been on the marketplace for 2 years. How can we fix it? We can't. We can't fix backwards. We can only fix this day going forward. So Arlene's gonna go on. She works with them. She's gotten permission, and she's gonna take him off at the end of this month. You could do it now, but end of the month. A day or two is not going to make a difference. And going forward, the daughter and wife will still be on. So you just treat that just like anybody else who went on Medicare and say, I don't know how it's going to get fixed in the back. I don't know how that tax credit is going to be adjusted, changed. And hey, when you talk to your accountant, could you tell me what happened? And then they tell you, then you'll know. I have never had anybody come back and tell me. And when I try to ask accountants, they don't always seem to know what I'm talking about. So maybe I have to find an accountant who's dealt with it and then say, can you please tell me how was this adjusted? Because I don't know. I've just never had anybody come back and tell me. So, Arlene, tell her, I can only fix going forward, but please tell me how it works out. I mean, their household income is still the same. The tax credit, depending on what plan they're in, might be very similar. So you just, it's unfortunate, but that's kind of how it works for those the back stuff.
My issue also though is, as I said, I talked to the marketplace yesterday.
Yep.
And the person that I talked to then talked to the supervisor because he didn't have the answer.
Mhm.
And he said, and so he came back and he said, there's going to be a problem. You're not going to be able to make a decision about if they can change, because they want to change the plan to a lower.
But I told
they
you how
wanna
to
go
get
to a-
around that.
You told me
Don't
how,
talk to
but
the marketplace.
I
Please don't
know,
do
I
that.
know, I know, I know. But they
I've been
said that I
doing
could,
that. I have been doing that since 2014. What I told you, I've been doing that since 2014. If they're already in the marketplace and you say they're losing coverage at the end of the month, the system will let you change. It just does. Now, they have to make sure they want to, they know their deductible, max out of pocket's changing.
right, right,
Now if they're with the same carrier, they're going from a silver to a bronze or vice versa.
right, exactly.
That will stay the same, but it has been working that way since 2014. I pushed a lot of buttons. I can't even tell you how many times I pushed buttons between 2014 and 2016 before I went, wow, there's a lot of things I know more than the marketplace because they
Yeah.
don't do this.
I know.
They really don't. You would think they do. Some of them don't even know how their own system works. I mean, I've been on the phone with them because of very, very weird reasons why I've had to, because I hate calling them. But they had to do something in the past. That's the only reason I call them, if I have to fix something in the past. And they're telling me how it works. And I'm like, wow, you really don't even know how your own system works. But I'm not going to argue with them. I'm not going to tell them that. Heck, they probably aren't going to be working there 6 months from now anyways. They have a really high turnover rate. So, I mean, supervisors usually can do a little bit more, but I can promise you most of the time they do not know the ins and outs of their own system. And so,
Okay,
yeah,
so
at least
I'm not-
it's the same. As long as they currently have, even when the SEP proof of that special enrollment period documentation was required to switch plan or to enroll them, even back then, this loophole worked. So, and I actually had a person, a husband and wife, the wife went on Medicare or the spouse did, and because I said, you can't change plans. She called the marketplace, and this was 2014, and they said, sure you can. And they did it. So I'm like, all right, if they can do it, I can do it. I've talked to Ronell in Hoffa, I've talked to some others. If the marketplace can do it, I can do it. I'm not doing something they can't do. And so it will work if you just do that.
Okay, so I don't have to wait for the eligibility results to see if they qualify for an SCP,
No,
because that's what he said.
yeah.
Okay,
But
thank
that's
you.
them not even knowing how their system works. So, yeah.
Right. Okay, thank you so much.
You're welcome.
Hey,
Sharon.
Chris,
Yeah, I
Chris,
saw it.
just to piggyback on that, because I'm in the middle of it, I did what you said, husband's aging in on 9/1, went in, did the whole thing. She's got a new policy set up. So on 9/1, sorry, on 8/31, when he calls in, all he's going to say is, I'm aging into Medicare, drop me. End of story.
He should not be calling. Do not
He's
have
not
her call the
calling.
marketplace.
Yeah,
You
I'm
do it on
doing
Health
it.
Sherpa.
Oh, I can drop it in Health Sherpa.
Yeah, that's where you do it. You go into Health
Okay.
Sherpa, you unclick him needing coverage, you walk through the entire application at the end, and you can do that today. Say she is losing coverage on 8/31. It will do all of the changes you just did effective 9/1. So that's how you don't have, that's how we got around having to wait to the last day of the month to end a Medicare. I mean, I did that for years. I would I mean, on vacation, I had my list of people that I had to call on the last day of, or not call, but I'd have to go in healthcare.gov and do that. So if you're still on healthcare.gov, you have to wait to the last day. But if you're in Sherpa, just say the person who's staying on the plan is losing coverage at the end of the month. It will not terminate that guy or the spouse who's going on Medicare until the end of the month. And then it just pushes all the changes to the end of the month.
So
So
on that
You
note,
shouldn't be calling.
I already did that. I went in, said she's losing coverage. We picked a new plan. I did not say he was jumping off.
Yep. So just redo it, unclick him.
And that's it.
Yep.
And then don't say she's losing coverage or anything, because I've already done all that.
I would do it anyways, just it's not going to hurt. And that way, because again, glitches. So I would do it exactly the way you've already done it. Unclick him needing coverage, because what you did was sign both of them up for 9-1. Just go through there, unclick that he needs coverage. Still say she's losing coverage 9-1, and it'll work just fine. And then he doesn't need to call. It's already done.
So when I said she was losing coverage, it only showed her going to the new plan as of 9-1, and the
Yep.
premium was just for her. So it just went her. Didn't include him.
But it probably kept him on the other plan. I would just redo
Yeah.
it. Just do that so that he's
Okay.
off. So the other plan's not sending him notices. He doesn't have to call. Yeah. Just say he's losing coverage, because it won't do it. And I believe me, I know how scary it is, because those of us who've been doing this a long time, we have absolutely terminated Medicare coverage people that were turning 65 in the month. We've done it on the 13th, and suddenly they lost coverage on the 13th. And you're like, what just happened, right? So it was a long time before I trusted Sherpa's system, but I had a client. I'm like, can I do an experiment? Because we do have a carrier who knows that's a glitch. So they won't terminate them on the 13th, the 12th, the 20th. They're like, if we get this in the middle of the month on their the last, month of their 64th year, we know it's a glitch, and they would cover them. So I had somebody, I said, can I do this? And it worked. And I've been doing it that way pretty much since I've been with Sherpa. So yeah, so
If
that's
I'm on the
trick.
marketplace, if I'm doing
Yep.
it on the
You
marketplace.
can't do it on
still,
the marketplace. They
Okay,
can
so-
only do it ahead of time on Sherpa. Now,
Okay,
I don't
so
know about
8
other enrollment platforms, so,
Right. But
I'm sure they
8/31
can.
is a Saturday,
Yeah.
obviously. So is that gonna
Yeah.
be a problem or
No.
no?
Nope,
And because it's a holiday weekend, no,
won't
no
matter.
problem. Okay. Okay.
Okay,
Yeah.
Chris,
The system, remember, the system's not smart, Arlene. That's part of the problem, is it's not smart. So it doesn't care if it's a holiday, Saturday, you're just doing it online at .gov, and then it goes effect on the next day.
Okay. Thank you.
okay, Chris, so just to reiterate, okay, because I have been one of those people that terminated them on like the 20th by accident, on a
Yep.
Medicare one. Okay, so the person that's on the plan is coming off, going on Medicare. Are you saying that we're going to take them off as of August 31st? Do we have to wait till August 31st, or are
Nope.
you know a way to get them off correctly early?
Correct. What I just said. Anytime. So tomorrow, we got 2 days, it's 9/1. So somebody's coming off in October to go on Medicare October 1st, and they're married, right? If they're single, you can just terminate it, but they're married or they've got a family. On 9/5, I can go in, update the application, unclick whoever's turning 65. Or maybe they're going on employer plan, whatever. Whoever's not needing the coverage for 10/1, unclick that they need it. Go through the entire application as normal, and then at the end, it will say, is anyone losing coverage? You say yes to the spouse who is staying on, and or
Oh,
daughter
okay.
or family. And then you just put the end of the month. So then I'd say 9/30 or 9/31. That just makes the Health Sherpa system, I don't know how they do it, but it makes everything you just did effective 10/1 instead of that day. And so he stays on, the spouse who needs Medicare for the rest of the month of 9 of, September, stays on, automatically comes off October 1st, and the family, the members that are staying on, the new changes happen. And this is so helpful because, as you all know, sometimes that premium is crazily different. And so this way you can do it ahead of time. They know what the premium is going to be. They can get the premium notice for the single person on the plan instead of both people on the plan. It will make your life easier. So that's just a little trick. I don't know how Sherpa does it. I don't, since they talk to healthcare.gov, but it does work. You just cannot do it at healthcare.gov. Don't try it there if you're, or have your client tried it at their healthcare.gov account. It has to go through Sherpa that way. And then that's a little trick. So you don't have to wait till the last day of the month. And oh crap, it's the 12th and they need their insurance. So then you got to call the marketplace and you got to get it back fixed, So we've been doing it that way, like I said, for years.
When you say unclick the T65, you're just saying they don't need insurance anymore.
Yeah, where it says,
Okay.
because you have to click who needs coverage, just
Right.
unclick that person doesn't need coverage.
Okay, good deal.
So, all right, we're past. Thank you very
Thank you.
much, everybody. I have a very full day of appointments, so I appreciate you all, and I will see you next week. Thanks for checking in.